Well, hello, and welcome to another dialogue with the Dean from the Purdue College of Pharmacy. I'm Eric Barker, Dean of the college. It's great to be back in person with our guests today, and as always, we're bringing you more campus updates. Before we start, I want to remind you that if you have any questions for us, be sure to leave a comment or question, and we'll come back to those and be sure to respond to them in the future. Well, today we're pleased to have with us Dr. Carol Ott. Dr. Ott is a clinical professor in the Department of Pharmacy Practice here in the College of Pharmacy and is a clinical pharmacist in Psychiatry and Gender Health at Eskenazi Health in Indianapolis. And so, Dr. Ott, thanks for joining me today. It's Mental Health Awareness Month, and we are going to focus on mental health. So why is mental health awareness so important from your perspective?
So I think prior to the COVID pandemic, we really thought a lot about how much stigma there is around mental health awareness. And for the individual person, it's really important to think about their own mental health and how they function every day in their life. The COVID-19 pandemic has really taught us about social isolation and interactions with other people and how important that is. And so it brings around another idea of a perspective of us with other people. So when we think about other people and their mental health, kind of what they're going through, that, that kind of adage of be kind, everybody's going through something, and really to think about it from that perspective. I think we've seen a decrease in stigma for mental health disorders over the years, primarily with things like depression and anxiety, but then other conditions as well, and kind of, the lack of access that people have. And maybe what they're not talking about. So what are they not telling us about what's going on in their lives that they may be fearful to talk about because of the stigma?
So from your perspective, both as a clinician and as a faculty member, how do you see mental health affecting college students?
Well, I think there are a lot of different perspectives as we think about, especially a university the size of Purdue, but any college campus. We have students coming perhaps for the first time away from home, looking for a support system, really excited about that independence, but maybe not really understanding how to manage that independence, and then adding the pressures of college and, figure out who they are, choosing their major, thinking about what their life is going to be like, and all of those things kind of converging at once. And really, maybe thinking when they came to college from high school, they were great. They did really well in high school, and then come to college and have to manage and deal with things that they didn't have to manage before. And so, they may feel stress and pressure because they want to succeed themselves. They may feel stress and pressure from family and friends. They may be the first person in their family to go to college. And then in addition to that, their majors, their professors, what they expect from them, and what they want them to do. And so as a clinician, I see patients in my gender health program that have anxiety and depression primarily. I practice in first episode schizophrenia, where we're really looking at young people developing psychosis and all the stresses and pressures that go along with that. So for college students, I think they put this expectation on themselves and then don't really want to tell faculty or staff or people around them that they may be feeling mental health concerns, because it may make them look bad, or that they can't really accomplish what they really want to accomplish. And from a faculty perspective, I think it's really important for me as a faculty member to think about the stress and pressure I'm putting on students in terms of what my expectations for them are, and how I can manage that myself, and really try and be open to students and maybe the mental health concerns that they're having. I found as a mental health faculty member that I'm primarily the one sometimes who gets those, Dr. I don't need to talk to you about this, especially in after the P2 year, when they have me for class and really thinking about these things. And because it's my practice area, I tend to talk to students about it a lot.
So as you think about all the roles that the big we, as faculty, as staff, as parents, as family members, what can we, the big we, do to help college students who are struggling with mental health issues?
Well, I think it starts with being open and accepting of struggles that students may be having. I think kind of across the board, we as human beings need to be open and accepting of struggles that people may be having. But we have to put ourselves out there as people, kind of how we interact with them to begin with. How open we are, talking about things, just generally open about things, really can help them understand that they can come and talk to us about situations in their lives that are going on. I think that is, we want them to be successful. And what does that look like? And really helping from an individual perspective. What what does their success look like, and how do we help them get there.
Typically in this format, we give the guest an opportunity to ask a question.
Sure.
So what do you have for me?
So I think my biggest question for you is, what, from the college and university perspective, what kinds of things is the college doing for student mental health?
So certainly at the university level, a real strong commitment by the Dean of Students Office and the Provost Office for continuing to find ways to improve services on our campus for our students across the board. Historically, and there's no secret about this, that I think the counseling service on campus probably has had a bit of a bad reputation in the student population. Some of it earned, some of it is a vestige of eras past, and it takes a while for bad reputations to sort of extinguish out of a population. So there is a strong commitment. There's a new director of the CAPS program, the Psychological Counseling Service, on campus for students. Very committed to helping improve our services for campus. And so first, it starts with that commitment to our students. I've said over the last 2 years, we've invested extraordinary efforts around the COVID-19 pandemic. If we would dedicate a fraction of that effort to addressing the mental health concerns on our campus, which are way more impactful on an everyday basis for our students, what a difference we could make on our campus and really show the world what a leader Purdue is. At the college level, we've started some things that we continue to refine each year. One is asking the students as they're coming in, and then every year subsequent to that, what is your mental health action plan? Or to get them thinking about it. It's the what ifs, right? What if I have a struggle? What if I begin to, knowing behind the scenes many of them are already struggling with something, but bringing this to the surface. They do that early in the P1 year. We revisit it at the end of the P1 year and every year after that. And so I think keeping to I think you mentioned, talking about it, bringing it, elevating it. So we want to give our students the opportunities to talk about it, but also be thinking about it and know that we're thinking about it. We've embedded things in the curriculum. We've done mental health first aid. We've done QPR training for faculty and staff, which is around suicide prevention. And so I think part of it also is equipping our faculty and staff to talk about it, to destigmatize it, so that it's a regular part of our conversation, so that faculty and staff are at least comfortable with an initial conversation. They don't have to be the experts, but they can be an ear, and they can help students then find other resources to support them. And then we've tried to embed more and more, and we'll continue to do that. I think the pandemic again derailed some of our efforts here around general wellness. What can we do to have conversations around self-care, around just the low-hanging fruit, if you will, sleep habits, diet, exercise, all play a role to it, how we cope with and manage stress. We're all going to face stressors in life, and it's going to be how well equipped are we to handle those when some of those come. And each of us will respond differently, and having the license and the freedom and the grace to work with individuals from where they are, and not where I'm at, but where you are or where they are. So we're having those conversations. We're trying to elevate it in our wellness initiatives. I'm hopeful that as we now take the next step back to normal, we'll be able to even take many of those things to a greater level. But I hope holistically we're trying to be proactive as much as we can, and again, to your point, destigmatize the conversation around mental health. So thank you for all your efforts to your patients as well as to our students. Your passion around mental health is very greatly appreciated, and I appreciate you spending some time with me today.
Thanks.
So again, thank you for joining us. Please comment on the video if there are topics that you would like to see us cover in the future. Please let us know what those are, and we'll be sure to follow up. We'll see you again next month. Thanks again for watching, and as always, hail Purdue, and boiler up.